Hi, my name's Tom Towie. I'm one of the ECC vets that works at Veterinary Referrals in Manchester. Today's course is going to be a nursing introduction to POCUS techniques. The morning sessions, we start off with information just about the basics of ultrasound and what the normal organs of the abdomen look like. And then we'll talk specifically about some of the protocols that we use in our patients that arrive to us after road traffic accidents and trauma, all those emergent patients that are looking really quite unstable. We'll have a look at the free fluid that can develop in abdomens and what that means, how to spot it, and how that can affect our patient and our patient outcome. In the afternoon, we're going to move on from the abdomen towards the chest, and we're going to look at the causes of some of the pathologies that we see in the chest. So specifically the Vet Blue protocol and the TFAS protocol, which will look at pleural effusions that develop, pericardial effusions that develop, how to spot pneumothorax with the ultrasound scanner, and how to identify abnormally wet lung tissue and what that means. And then right at the end of the day, there's a bit of information about some basic cardiology and some of the basic cardiology scans that with a bit of practice, RVNs can become accustomed to. So moving on to the probe and how you move that probe, and then how that causes the image that you're seeing on the ultrasound scanner. So I know we've spoken about the fact that we've got these different probes that we can pick up, but when you pick up the probe, you can, depending on the probe that you're picking up, you can hold it in a slightly different way, okay? So all of the ultrasound probes that you'll have, including the ones downstairs, they've got these little markers on them on one side of the probe, and that marker enables you to orientate what you're doing with your probe and therefore what you're seeing on the ultrasound screen. So it's really important to know where that marker is. There are some scanners out there where it's like a little LED light, or it's just a little bump as opposed to something that you'd look at and go, oh, there's the marker. But they've all got one. You can see one just under my thumb on this slightly bigger probe as well. Depending on the size of the probe will depend on how you hold it. So for these bigger probes, often you'll need to have it in the palm of your hand, and that usually means that your thumb needs to go on the marker, okay? Some of the smaller ones, the microconvex probes that we'll actually be using today, again, your thumb can go on the marker there, but sometimes you can hold it like a pen, and in that way your index finger will go on the marker as well. So it doesn't really matter, to be honest with you, as long as you know where the marker is and you've got a finger that's on it so you can locate where the marker is, then that's all you need to know. And there are times, you know, as you're moving around the abdomen or the chest, there are times that you'll have the probe in your hand because that's more comfortable, and then you move to a different location and you'll have it like holding it like a pen. So you're allowed to change, you know, throughout the scan that you're doing, as long as you've got a thumb or a finger on that marker and you know which way that is. Why is that so important? Because wherever your marker is corresponds to where the marker is on the ultrasound screen. So every ultrasound image that you'll have, there'll either be a red circle or a green circle, or in this instance, LS7. No idea what that means. That's there, but there'll be something that you'll see on the ultrasound screen that will tell you where your marker is. So in this instance, if your thumb or your finger is on that marker and that marker is on the left-hand side, if your thumb or finger is pointing towards the head of the dog, so cranially, you know that the left side of the screen is cranial, okay? And similarly, the opposite is that the right side of the screen is then towards the tail of the dog because you've got your finger on the marker and the marker is facing the head of the dog or cat or rabbit or whatever you're scanning. So that's why it's important to know where the marker is and to correspond that to know where the the marker is on the screen. So you'll then put your probe with the marker facing cranially on the skin, and you'll get an image that looks a little bit like this. Just to confirm that as the probe comes here, it's emitting the sound that's getting reflected back. So this first layer and these layers here, that's the skin. And this is the superficial area, and it's becoming deeper the further away you get from where the ultrasound probe is. So whenever you see these images, usually they're going off at an angle because you're using the curved probe, remember, and it's giving you this, this angled image. The content that you can see at the top of the screen, if you think about your ultrasound probe coming there, that's superficial and everything else is deep to that. And then you can move the probe around itself, and it is kind of important for when I'm trying to describe to you what to do about what to know to do with these probes. So essentially there are 4 basic movements with what you'll do with the ultrasound probe. So you've got sliding, so that literally is sliding the ultrasound probe this way, that way, forward and back. You've got fanning. If you think about fanning with a hand fan, that's when you've got the ultrasound probe and you're moving it, sort of left and right along that plane, and you're fanning through the image. Rotating it is turning it 90 degrees or 180 degrees or however many degrees that you want to turn it. And then rocking is if you were to have the ultrasound probe like this, held on the skin, it would be rocking it back, forward and back. Okay? So they're the ultrasound movements that you do. When you're doing the ultrasound scan itself, you're not like, oh, am I fanning? Am I rocking? Am I turning? A lot of it becomes intuitive after you've done it for a short period of time. It's just that whenever you're reading textbooks or whenever you're listening to people, whenever you're listening to people like me, if I'm saying fan through so you can see the liver, you kind of need to know what I'm talking about with those. So they're the 4 basic movements that you'll do. So I'll mention that a couple of times today.